75% of infections in the FCT are among young people aged 20 to 40, and guess what? They're largely asymptomatic. So when you refuse to adhere to non-pharmaceutical guidelines like wearing a mask or social distancing, you're spreading the disease and infecting people with weaker immune systems, such as the elderly. What can be done? My guest is Dr. Josephine Okechukwu, the Director of Health Services at the FCDA. She just recovered from COVID-19, thank God, and is hitting the ground running with the fight against the disease. In our Abuja wrap, President Muhammadu Buhari is briefed on the progress of the Economic Sustainability Plan. He promises to help Governor Sanwo-Olu rebuild Lagos, and he holds bilateral talks with China. This is Dateline Abuja. Hello and welcome to Dateline Abuja. I am Kayla Megwa. It appears we may have to wait a while for the vaccine for COVID-19 to go around the country. Nigeria's Ministry of Health is still working out the modalities, and like we said last week, getting the vaccine to every part of Nigeria will be challenging. So until then, adhering to the non-pharmaceutical guidelines is the way to go. However, this is proving to be a problem that the FCT administration says they will do whatever needs to be done to solve. Before we get into that, let's look at this week in Nigeria's seat of power. Vice President Professor Yemi Osinbajo has given President Muhammadu Buhari an update on the implementation of the Economic Sustainability Plan. The plan is Nigeria's response to the health and economic challenges foisted on the country by the novel coronavirus. The Minister of Humanitarian Affairs and Disaster Management, Hajiya Sadiya Umar Farouk, led a delegation of people living with disabilities on a private visit to President Muhammadu Buhari. Speaking at the meeting, President Buhari restates his administration's commitment to the cause of the disabled in Nigeria, pledging to implement more projects and programs to ensure their inclusion in national growth and development.
I thank the governors of Plateau, Lagos, and Nasarawa states for enacting disability laws and establishing disability rights commissions in their states. I am calling on governors of Yobe, Kano, and Kogi states to implement their laws, while those states who are yet to do so should take necessary action to enable federal government efforts have the desired impact at the subnational levels. Let me conclude by enjoining you as a team of the Commission to realize that your work forms a critical aspect in achieving the objective of our administration to removing 100 million Nigerians out of poverty. I am therefore looking forward to commissioning projects and programs of high impact to the disabled community.
Meanwhile, President Buhari received Governor Yahaya Bello of Kogi State at the State House in the company of the chairman of the All Progressives Congress, Governor Maimala Buni of Yobe State. The meeting was held behind closed doors. Both men declined to speak to the media after the meeting. Also, the president met with Governor Abubakar Bello of Niger State. Speaking to State House correspondents after the meeting, Governor Bello vowed to deal ruthlessly with traditional rulers and other local collaborators conniving with bandits to wreak havoc on innocent citizens in the state.
I don't see how someone that is used to robbing at gunpoint or killing, I don't see how that person would say, okay, let's go to a negotiating table, I will drop my arms and I will just move on with my life without asking for some kind of support as an alternative to their activity. So I tried it once, reluctantly, it never worked. So I don't think, unless I see some evidence of sincerity, but I really am not interested in such negotiations.
It was indeed a week for governors to hold private meetings with the president, as Governor Babajide Sanwo-Olu of Lagos became the fourth governor to meet with the president in the State House. After the closed-door meeting, Governor Sanwo-Olu explains that rebuilding Lagos State after the NSAS protests will take time. He also told State House correspondents on his plans for the second wave of the COVID-19 pandemic.
We have started building what we call oxygen tanks, oxygen facilities. We're building about 10 of such facilities. I think we've commissioned about 4 or 5 of them, and we're also building proper oxygen plants, additional to oxygen plants in the state, so that we can meet, the respiratory requirements. We understand the virus more than where we are 10 months ago or 8 months ago. So we know what the treatment should be, and so we're better positioned for that. We're carefully taking out a proper study to know what we need to do. But we've started something. Businesses that were affected, small businesses that were affected, if somebody, having a shop looted or pawned or something, we've been able to directly begin to support such businesses, especially on the micro, small level, using the Lagos State Employment Trust Fund.
Nigeria has opened talks with the People's Republic of China on how to procure COVID-19 vaccines for the country. Speaking after a closed-door meeting with the Chinese Foreign Minister, Mr. Wang Yi, Nigeria's Minister of Foreign Affairs, Mr. Geoffrey Onyema, says China has been assisting the country since the advent of the pandemic.
China is also one of those countries that has been able to develop vaccines for COVID, and so we're also engaging with China to also help with regards to access to vaccines for our people.
By the end of January, Nigeria is expected to take delivery of approximately 100,000 doses of Pfizer-BioNTech vaccines. This is according to the Executive Director, National Primary Health Development Agency, at the weekly briefing of the Presidential Task Force on COVID-19. He adds that the free delivery of 42 million doses of vaccines will be a combination of all available and approved vaccines in the market and will be secured to cover 20% of the Nigerian population.
Nigeria is expected to secure free delivery of 42 million doses of vaccines, which will be a combination of all the available and approved vaccines currently in the market. This is expected to cover about 20% of the population. 40% will be vaccinated in 2021, while 30% will be covered next year.
Meanwhile, the federal government may be considering another lockdown following reports of a flagrant disregard for the COVID-19 protocols.
The Presidential Task Force is very concerned about the increasing daily numbers that we are recording. Yesterday, 6th of January 2021, we recorded 1,664 infections. This is yet another all-time high in Nigeria, and we must all take full responsibility through compliance and vigilance.
After being out of the public eye for a while, the Chief Justice of Nigeria, Justice Tanko Muhammad, has appeared in public to swear in the acting Chief Judge of the Federal Capital Territory High Court, Justice Salisu Garba.
You should remember that the time we are in now are times that are quite perilous. So we must gird our loins to give our best in every task given to us with a view to moving our nation forward.
Abuja's 75% infected young population could hold the key to slowing down the spread of the coronavirus in the nation's capital. And our feature story explores that possibility. Pape, a shanty community 10 minutes drive from the Abuja city center. The slum has survived several demolition attempts by successive governments, with series of court cases between the FCT administration and residents on resettlement issues. Pape has a growing human population and a corresponding rise in the number of shanties. In April of 2020, when the FCT administration started community testing, Pape presented the opportunity to find active cases in the nation's capital. And it proved right, as the area was marked high risk in view of the number of cases recorded during the community testing. A few months after, many of the residents are still not complying with the protocols.
We have fears and we maintain the distance. We know everything is in God's power. You know, when you have hope in God, God will do everything for you. The satanizer is just a helping hand. Our life is in God's hand.
I know it's not because of the sickness that make things to be changed like this. It's because of sometimes I think whether we offend God. I say, God, let your mercy come down so that your children will have something eating. And I am praying with government that they should help us and do something tangible.
The nation's capital is witnessing a high number of cases, according to statistics from the Public Health Department of the FCDA. For instance, between December 1st, 2020 and January the 5th of 2021, over 5,500 cases were recorded. 21 people have died within 33 days. However, over 6,600 cases were recorded between March and November of 2020. In all, over 13,000 cases have been recorded, out of which over 5,200 are active cases, while over 7,700 cases have been discharged. The death rate has crossed the 100 mark. Perhaps even more worrisome is the infection rate among people between the ages of 20 and 50.
The majority of the cases recorded are between the ages of 21 to 50, and this poses a lot of risk to the elderly. During this holiday, I'm sure most of us went home to see our grandmothers, our grandfathers, and so in the process, if we were careless, we would have transmitted this virus to them.
While the FCT enforcement team is making efforts to ensure compliance with the protocols, public gatherings like the enrollees for the National Identity Number are violating the guidelines.
Just look at the crowd here, because when that man came out, you can see how people got jam-packed here just to confirm if they are going to do the national ID card for them. If there is COVID-19 now here, many people will be affected. So many, as you know, they say they don't want crowd, and here we are here crowded because we want to do national ID card.
The government continues to encourage Nigerians to take personal responsibility to help in reducing the cases of COVID-19 in the country. But some residents of the nation's capital are still lackadaisical about complying with the protocols.
There are too many people that believe if so person do something like this, then that thing is good. I have to do it. And there are so many people that believe that since this person is not doing it, I need not to do it. Because we have people that we are looking up to. That's why I said the government is negligence. It's negligence. Now, since the rate is increasing, why didn't you put apparatus that will make people create more awareness?
There's nothing like COVID-19 in Nigeria, especially. It can be in the foreign country. Yeah, because one, in Nigeria we have hot weather, and hot weather does not even welcome something, cough, all those things. Yeah, except only dust. Well, in this side of COVID-19, it may be real to others, for those who are flying out through a flow. But the citizens inside, I doubt it.
We are saying that if these numbers continue to go up and we start having significant deaths, we'll have no option. And if we do not want to lock down, now is the time to make sure that we follow these non-pharmaceutical interventions.
However, some would not welcome another lockdown.
If you tell me to stay on lockdown, that don't go out to do your daily business, and somebody for me now, I'm expecting salary. Now tell me, if I don't go out to work, tell me, how do I get to feed? And I have responsibilities. And tell me now, for example, you keep me at home and you didn't provide any means for me to survive. So what did then staying at home now, I start thinking of, evil thoughts start coming to my head, going to go and take someone else's property, which is very wrong. So I don't want to do that. So if the government wants to keep us on lockdown, they should provide a means for us for survival.
I should not be locked down. If there is lockdown here, somebody like me, I will shrink. I hunger now. If you want me, I should stay inside there. You will not give me something to eat. Abba. No, cannot. There should no lockdown. If you want us to go for second lockdown, provide us food. Give us money that will sustain us They should not even better think of lockdown, because the lockdown will surely affect us.
One of the recommendations of the World Health Organization in containing the spread of COVID-19 is social distancing. According to the Federal Capital Territory Administration, suburbs in the nation's capital are not complying with the directive, and Abaji, one of the most remote area councils, is witnessing a high positivity rate. Dr. Josephine Okechukwu has been in charge of community testing in the FCT, and she just recovered from COVID herself. Hey, it's one of the hazards of the job, right? Well, she's fine now and talks to us about the rising cases of COVID-19 in Abuja by demographic and the plans to dial that number all the way down. Dr. Josephine, welcome to Dateline.
Thank you.
You know, the last time I spoke with Dr. Kawu and Mr. Ekaro, I literally screamed when they told me you had COVID and you were in isolation at the time. Could you walk us through your experience with that?
You know, when you're in battlefield, you are bound to have some degree of trauma. For me, my experience when I came down with COVID-19, that was on the 3rd of December 2020 that I started having the symptoms. I got tested promptly and then the result came out. I was moved to the isolation center. My experience was not that too good because I developed majority of the symptoms. I came down with nasal congestion, itching of the throat and fever, headache, and I vomited once with cough, with bad malaise, general body pains. I was promptly managed. When I got to the treatment center, the isolation center, the drugs were instituted promptly and other tests were carried out on me. The services rendered to me there was very good. I managed to pull through because the infection continued for about 1 week. So within 5 to 6 days, the symptoms subsided except cough. I became okay. But COVID-19 is something that I would not wish people to keep on coming down with. It wasn't that good.
I mean, the numbers keep rising in the FCT.
Yeah.
What do you think is responsible for this?
When we look at it, initially we had, I'm just thinking that first phase was like an introductory phase for COVID-19 to us in Nigeria. And we needed to take it seriously. This second phase, a lot of people that were infected in first phase that didn't go for testing, that didn't even know that they were infected, were the ones that kept on transmitting it in the community. And there were so many activities going on. People initially thought that COVID, that anxiety was there. And after some time, when the cases were going down, they dropped their guards. So they were not complying or adhering to the use of the non-pharmaceutical preventive measures, like wearing of face masks, maintaining physical distancing. You can imagine towards the November, December, when there were so many social activities like wedding and everything, so people were not wearing face masks. So that sort of brought up that surge in the infection of COVID-19. So that's why the effect is what we are experiencing now. And it's going to be worse because with the festive period that just passed, Christmas, New Year, people traveled. A lot of people traveled. So that means there's going to be another surge in the cases that we are going to have in this first quarter.
This second wave, is it deadlier? People are saying this is deadlier than...
Being deadlier, when we talk about being deadlier...
More infectious.
More infection in terms of transmissibility. A lot of people are coming down with the infection, right? For now, we've not really established the strain that is causing it per se, but many people are getting infected. Like many families, many homes, you have more than 1 or 2 people coming down with the infection. So if you have many people getting infected, that means the possibility of further transmission of the infection is quite high. So that's why we're talking about being more infectious or deadly, more deadly. And people coming forth to get tested, getting it right, to know that these are the symptoms of COVID. Getting tested and commencing medication immediately is still a challenge. So the mortality will still increase, infectivity will still increase. So when we're talking about infectivity, that is what it means.
I'm going to get to community testing, which is what what we know you for in a bit. But let's talk a bit about demographic, because this week we're looking at young people. Initially, many young people thought they were immune from this disease.
No way.
Talk to us about the demographic mostly infected. Who are you seeing coming into the hospital? Who are those who are loading up, who are filling up the isolation centers? What demographic?
Yeah, in terms of distribution of COVID-19, the young adults are the most heavily infected people.
Young adults?
Young adults,
So
between the ages of 20 to 40.
20 to 40.
20 to 40. And they are the ones that are asymptomatic. Majority of them don't have the symptoms. They get heavily infected and they spread this infection across board because they don't even know they have it. So from our data, majority of the patients that we have are between the ages of 20 and 45 per se, right? And majority of them are males. Males are more infected than females. So possibly or probably because of their activity, they are the most mobile or highly active and highly mobile in the community. In the homes, they are the ones that you cannot strap down to stay at home. We are talking about people stay at home, don't move around. They socialize a lot. So that is why you have it more in them.
Attending super spreader events,
weddings,
church, mosques,
hanging out,
restaurants, clubs, bars.
Yes. Yeah. In the market, you see them there. In shopping malls, you see them there. In the night, they don't stay at home. They still socialize.
Yeah, so, but there isn't a lockdown, is there? They're allowed to go out. It's just they have to live a little bit more carefully.
Yes, that is where we're having the challenge. If they take responsibility and live carefully, right, the transmission will get less. And we are worried because these are the people that go out. They suffer the infection. They don't have the symptoms. They bring the infection to the homes and then infect the elderly ones who are their parents. And they end up dying. Some of them end up dying. It's really worrisome. If there is a way they can listen and make sure they play safe and keep their family and loved ones safe, the country will be okay.
They keep talking about this, I have to hustle. I have to go out. It's possible, not so, correct me if I'm wrong, it's possible for you to hustle and stay safe at the same time.
Of course.
So what's the problem? Just live a little safer, wear a face mask, making these things. What's the problem? Why can't we make these things a part of us? Just make it normal not to be in a crowded place. Make it normal to wear a face mask. Not just for yourself. You may have the infection, but you don't have any symptoms. But the idea that you could, and that's another topic that is really being talked about right now, that's empathy. The idea that you could infect someone who's less, who's more immunocompromised than you are.
Very vulnerable, yeah.
So why don't many young people want to take that responsibility?
I don't know. You see them, many of them have the face masks with them. They either put it in their pockets or in their handbags, or they just wear it, using it to cover their chin or their beard. So it's really a problem. If you have your face mask, why not wear it? Cover your nose and your mouth so that you protect yourself and protect others. This is the area that we really need to start telling the young ones. Unfortunately, I don't know what they are thinking when they do that. Let me tell you the truth. Many of these young ones nowadays have not seen a corpse. They've never seen a dead body. So when you're talking about dying, to them it's just like it's imaginary. They just imagine what does it mean for somebody to die. But when they've seen a corpse, seen a dead person, more so a loved ones, they become very cautious, right? But that is medicine after death. They need to listen and know that everybody has to play safe. This second wave, we don't know where it's taking us to. We are just entering the second wave. Only God knows how many people that will be affected or infected. Only God knows the mortality that we are going to face this year. So, but we are prepared for this first quarter. Let's see how it goes. But a lot of people need to take responsibility.
Doctor, are you going to resume community testing?
Yes.
When? Wait, they said it was supposed to start beginning of this year.
The beginning of this year, yes. We've gone around the area councils. We've done that community testing, but community testing means testing everybody across board. We are going to. We've already made the plans and arrangement to establish testing sites, sample collection sites in every area council. If possible, every community should have a site where they collect sample for testing in the testing sites. So we are going to commence that community testing in all the area council, because a lot of community have COVID, and if you do not test, you will not get them.
Well, good luck, Dr. Josephine Okechukwu.
Thank you.
I'm so glad you're healthy now.
Yeah, I'm okay.
And continuing the good work that you do.
Thank you very much.
Thanks so much for being on Dateline.
My regards. Thank you so much.
Can you imagine being the one who infected someone with a disease that ended up killing the person? I can't imagine it. Empathy must be our watchword, especially in these times. You may feel fine, but you may be responsible for making someone else sick. That thought alone should push you to wear a mask in public and social distance. Please, if you can't do it for yourself, do it for others. We will get through this only if we do it together, and that's something that we all have to work on as a team. That's our show this week. Remember to share with us the happenings in your neighborhood. Thank you so much for watching. I'm Kayla Megwa. See you next time.